Good evening. My name's Humphrey. I'm the president of the Asian Australian Project, and I'm going to be your MC tonight with four lovely panelists. We warmly welcome you to our second Fireside Chats, You, Me and Mental Health. So in case you're new to what we do, we are essentially a social organisation that helps young Asian Australians to engage with their unique experiences and to really embrace our unique cultural identities. And just for reference, we define Asian Australian as anyone with Asian ethnic heritage who has lived in or lives in Australia. And I might use that interchangeably tonight with the term, having an Asian background or something similar. But despite that, our events are open to everyone, and especially for tonight's topic, where we might talk about helping others, helping loved ones. I think this chat will be useful no matter what your background is. So there's just a few things to really housekeep before we start. So firstly, I just want to acknowledge country. I want to acknowledge the Gadigal people of the Eora Nation, who are the traditional custodians of the land where I'm doing this panel from in Sydney. And I'd like to pay my respects to the elders past and present. I'd like to extend that respect to the traditional custodians of wherever you may be tuning in from, and extend that to any Aboriginal and Torres Strait Islander people here today. And so just a few housekeeping notes as well. So firstly, the event's being recorded, so we can share this to people who might not be able to attend today. Secondly, please ensure that your mics are on mute if you're in the audience, if they aren't already. And thirdly, we do have time for audience questions at the end of the event. However, there's actually a form that you can submit any questions you have throughout the night. We might be able to bring up on the actual chat. But if you have any questions, please submit them on the actual Zoom chat, and we can get through them towards the end. And so let's just firstly kind of dive into what we mean by mental health. So talk a little bit about the concept before we start going into our lovely panelists. So there's a lot of text here, but essentially when we talk about mental health today, we do want to talk about something that is a little broader than what some people might commonly conceive as mental health. And so, according to the World Health Organization, mental health isn't just about mental disorders or mental illness or mental disability, which are, common terms that we might hear today. We're actually also talking about mental health in the context of general well-being. And I think that's a concept that, my far more qualified panelists can talk about tonight. But the second point on this slide is really to share that mental health is quite common. So even when we do talk about mental health disorders or mental illness, we can see that it's actually really common in Australian adults, both over the course of a lifetime and even in kind of an acute time frame, so in the past year. And so just kind of keep these very general ideas in mind when we actually talk about why mental health is important later on. However, having said all this, we do want to note a few things. So firstly, this is a talk about mental health, but it isn't a substitute for any personal or professional medical advice. If you do happen to be experiencing a crisis or you have something kind of that needs personal attention, please consider one of the three options that are in the slides there. So New South Wales Health Contact a Service gives you a bunch of broad options. Lifeline and Beyond Blue also offer 24-hour support, which might be helpful to your needs as well. And a second quick note as well. The term Asian Australian is a very, very broad term. And so we just want to kind of acknowledge that we're always using a bit of a shortcut when we use the term Asian Australian, because there are lots and lots of nationalities and cultures and languages and religions. And so what we talk about here today might have some, general kind of themes. We might dive into some specific examples. But once again, we're never going to be able to cover all that diversity. And so please, like the previous point, if you need to seek any kind of personal medical advice, we encourage you to do so. But without further ado, let's introduce our 4 lovely panelists who you can hopefully see on the screen with you today. So if we could just spend 2 minutes for each panelist just introducing yourself, what you do, and what you do, and that might be relevant to mental health as well. Starting, I guess, top left and going clockwise. So Asami, lucky first.
Sure. Well, good evening, everyone. And thank you so much to Asian Australian Project for having me this evening. It's lovely to be here, and also so wonderful to see so many people interested in the topic of Asian Australian mental health as well. So my name is Asami, and I am the founder of Shapes and Sounds, which is an online platform that talks about Asian Australian mental health and well-being. And what that means is we don't talk about, or we don't answer questions such as what is anxiety. There's lots of resources that you can go to for that. Instead, Shapes and Sounds is really interested in the intersections between mental health and culture being race, identity, community, etc. So instead, we like to discuss questions and topics such as how do experiences of racism impact our mental health and well-being? And how do things like the model minority myth or the bamboo ceiling, how does all of that impact the mental health and well-being of Asian Australians? My journey into Shapes and Sounds has been a very long one, but predominantly it was informed by my last 5-6 years of working in the mental health and community sector, in the youth mental health and community sector. I'm something called a registered music therapist. I'm also a yoga teacher, and I've worked predominantly in the context of trauma. And what I started to notice in my work, and predominantly with the organization that I used to work for, which was quite a big organization, was that I sensed that a lot of young Asian Australians were falling through the cracks in our service delivery. And what I thought was interesting was that the conversation within organizations and partnering organizations circled a lot about language, around language, talking about how we should cater to the needs of our POC clients predominantly through translating documents or providing interpreters, which I think are both very, very valid and important things. However, when it comes to Asian Australians and our community, I sense that it's not really such a language issue that presents a barrier to us engaging in mental health services, but there's a bit more of a culture barrier. And our culture being that diaspora culture, we live between the East and the West, in between 2 sets of values, 2 sets of ideals. And I feel like the mental health sector is not quite up to scratch in terms of understanding Asian Australian people and their needs. And so I started to write about this. And the moment I started to write about and share content on the internet, I realized that I really was not alone in my thinking, and that there are many, many people thinking a lot about the need for greater culturally responsive practice, especially for our Asian Australian community.
Great. Why don't we move to Charles?
Yeah, sure. Thank you. So good evening, everyone. So my name is Charles Chen. I'm a consultant psychiatrist, and I'm working in private practice in Sydney. So as psychiatrists, we are doctors who specialize in promoting mental health well-being, as well as diagnosing and treating mental health disorders. So I did my medical degree and my psychiatry training in Sydney. I've worked in mental health for about 12 years. So I've spent some time doing psychiatric research work at Sydney University. I've also done some work in forensic psychiatry with the New South Wales Justice Health. And in the last few years, I have spent most of my time in private practice. So I'm the director and founder of my clinic, Mind Oasis Clinic in Sydney. So I set up Mind Oasis with the vision that it's going to provide a holistic approach to mental health and well-being. So in our clinic, we have a group of medical specialists and allied health staff. We're all working under one roof to provide the service. So we're only one of a handful of such clinic in Sydney to provide, this kind of holistic approach. So we believe that in this approach, we try to incorporate the physical, the psychological, the social, the cultural factors in a person's mental health well-being. So tonight's topic is very relevant, very important to our clinic. And of course, the topic is very relevant to me personally. So a bit about myself, I was born and grew up in Hong Kong. So I speak fluent Cantonese and some Mandarin. I came here when I was 18 as an international student. So back then I was still a young man who identified myself as, being a Hong Konger who lived in Australia. And it always fascinates me how over the years I've transformed, to see myself as, being an Asian Australian. So tonight, I think, talking about mental health in Asian Australian population is very close to my heart. So, well, thank you for inviting me, and well done to Humphrey and his team. I think it's a great effort to Humphrey, being a first-year medical student, achieving this. I was still mucking around a bit in your age, so well done. And I look forward to a great discussion tonight.
Thanks. It's mostly my team and not me, but thanks anyway. Okay, why don't we move to Monica?
Sure. Hi, everyone, and thanks very much for having me at this Fireside Chats tonight. So a bit about me. So I'm the co-founder of Heath in the Room. And for most of you, you won't understand what Heath means, but you can assume it means elephant in Hindi. And essentially what we did was we set up this community-based organisation about 3 years ago. And it essentially targets the South Asian community. So, your Indian, Sri Lankan, Pakistani, Bangladeshi, etc. communities. And we really just wanted to target our community and raise awareness around mental health and reduce the stigma that existed in our South Asian communities. So over the last 3 years, we've, I guess, been involved at a very grassroots community level, holding different sorts of events and projects with that one goal in mind of trying to raise awareness and reduce stigma. A bit about me, my motivation to sort of join this movement came from my own lived experience with mental health issues. So they first presented about 10 years ago, and I was obviously able to seek help and sort of manage it, and have been able to manage it for over the last decade. So, however, I obviously had an experience of those cultural factors impacting on my ability to deal with it and speak to my own community. And so that was an incredibly big motivation in terms of setting this community group up and to continue that conversation within, as I said, our South Asian community, but the broader Asian community, because a lot of the issues are much the same. So thanks, Humphrey and team, for having me. Looking forward to the rest of this chat this evening.
Great. And lucky last, G.
Thank you. Hi, everyone. And thanks to Age Australia Project and the team for inviting me tonight. So like Charles, I'm a psychiatrist, but I also wear other hats. I'm also an academic at Melbourne University. And as a clinician, I work at the Melbourne Clinic, which is the largest mental health hospital in Australia, where I look after inpatients, outpatients. There are also a number of day programs and outreach services are provided by the hospital. At the public hospital, I work at a WHO, it's the World Health Organization Collaborating Center in mental health, where we look at how we collaborate with partners in the region to build their capacity in mental health care. And as a researcher, I'm also one of my interest areas is in the area of cross-cultural mental health and psychiatry. So I have worked with a number of partners across the Asia Pacific to look with a variety of different clinicians, multidisciplinary staff to improve their mental health care in the region. So I'm pleased to be here to share my views and to take part in this panel discussion.
Great. So thanks for introducing yourselves. There's a very diverse and accomplished panel here today, which is, I think, going to be really useful when we start discussing things. So I guess let's start this panel off properly with a very introductory question. Why does mental health matter? And in particular, why does it matter to look at it from an Asian Australian perspective? Feel free to take the question on.
Yeah, I may start. So I think, mental health matters. I mean, it is relevant to every one of us. It's just like physical health is relevant to every one of us. I think Humphrey, pointed out a very important point that, mental health well-being is not just about the absence of mental health disorder. So I've just picked up the WHO quote here. It defines mental health as a state of well-being in which an individual realizes that his or her own abilities, can cope with normal stress of life, can work productively, and is able to make a contribution to his or her community. This is really relevant to every one of us. So I think that the importance is also about, WHO has emphasized that preserving and restoring the mental health is crucial on an individual basis, as well as throughout different communities and the societies all over the world. So, I mean, it is important to, as a whole society on how we look at mental health. And I think that the language of mental health has really changed over the last 2-3 decades. The first impression I have on mental health is when I was growing up in Hong Kong. So we have this asylum, a mental health asylum in Hong Kong. It's called Chen. It's a sanatorium. So Chen, it becomes like a colloquial term in Hong Kong. So, if you want to say or joking someone they're crazy, you say, oh, are you from Chen? Are you insane? So, mental health is, when I was growing up, it's almost synonymous to insanity. Asylum is a place that you keep this group of people who have this unfortunate but irreversible condition that we need to lock them up. But I mean, in reality is, mental health condition is a lot more prevalent, and so I think that the language about mental health has changed a lot in the last, 2-3 decades. In Australia, definitely, and also all over the world. So in Australia, we have our first national mental health policy and plan in the 1990s. And a few years later, we have the second mental health policy and plan. So the expanding emphasis is that we have to, instead of keeping everyone in the asylums, we need to emphasize on community care. We need to build up the models to look after, people with mental health disorder in the community. And I think, this approach, it really relies on, we have to work with the clients or the patients. And I think the cultural element is really important. And I think also in our media, in our popular culture, the language has also changed. We have celebrities, we have sports stars who come out, they talk about the depression, they talk about the addiction struggle. Even our ex-Prime Minister, Malcolm Turnbull, who would speak out about his mental health, his mental illness, how he battled with depression and suicidality. So I think the more we talk about mental health, it becomes a lot more, we can understand it more, we can make it more relevant. So it's not just some people who are being locked up in the asylum. So I think, if we can look at that in what we call, look at the biology, we look at the psychosocial, we look at the cultural factors of a person, then we can promote, and we can promote a better mental health in our community, as well as we can treat, our patients who have mental health disorder in a more holistic way. Yeah, that's what
that's a theme I've already gotten 3 or 4 times, is the idea of looking at different factors that you don't normally associate maybe with mental health.
Mm.
Yeah. Did anyone want to add to this one?
I really liked what you said, Dr. Charles, about how there is no real separation between mental health and physical health. And I think that it's very, very interesting that somewhere along the line, the body and the mind became quite separate in the way that we talk about things and the way that we approach our physical health and our mental health. It kind of got separated at some point along our history. So I think that why mental health matters is, if you care about physical health, then, or you care about your health as such, then your mental health plays a very large part of that. And I think if we bring it back to even looking right now during these COVID days, especially in Australia, many of us are physically quite safe and quite well. However, I would say for me, being able to maintain my mental health has been probably my greatest asset throughout this pandemic. And I think it's the ability to regulate your emotions, or the ability to reframe your thinking. And like taking care of your mental health almost becomes a bit of a superpower when it comes to facing things like a global pandemic or any other kinds of adversity that we face, I guess, in our lives.
Yeah, I'll just add. I think I agree with you, Asami. I think the body and mind, they particularly, I think in the Western culture, they're quite separate. I think it's to do with the philosophical, the Cartesian dualism, that the body and mind is somehow separated. But I think in a lot of Asian countries that may not be the case.
Yeah.
In fact, the WHO has been promoting the integration of mental and physical health for about a decade now. WHO has been using the slogan "No health without mental health," and I think that we have been too, I think, narrow in focusing on physical health as almost separate from our mental well-being, and that's been a mistake, as research has shown that in fact most of the chronic illnesses that our country and society is facing now, things like heart disease or diabetes or even cancer and other chronic disease, they have a very, very close interaction with mental well-being and mental health. So if you have a physical condition, you are at greater risk of developing a mental health condition. And vice versa, if you have a mental health condition, you're more likely to develop a physical disorder. So I think that we have to now look at this more as a more integrated approach, that no longer we can just separate these into that dualism that we spoke about. And so it's essential that we try to see our health more holistically. And why culture is important, I believe, is because culture provides us with a cognitive or an emotional map that guides us into how we see the world, what are our beliefs, what are our values, how we behave, how we experience the world, how we think about ourselves. So you can see that how culture can be actually quite fundamental in terms of how we understand our mental health and understand how we interact with others in the world, as well as how we experience mental stress and mental disability. So it's really, I think, integral to our understanding of ourselves. So I think culture is really, really relevant when we talk about mental health, particularly.
I'd just like to add that. So I think absolutely agree, culture is very important, but culture can also be a hindrance to actually seeking help. So I'm sure we can spend a bit of time exploring some of those sorts of themes, but that's why sort of to that second part of that question, why is it important, is because we need to encourage people to proactively look after their mental health, but also to seek help. And if there are factors, cultural factors hindering that, we need to start those conversations to unpack what those factors are, so people feel comfortable to go and access the support that they need.
Yeah, I think all very interesting points, and I think we are about to look at them a bit further. So yeah, what we're going to do now is really to dive into some more specific issues surrounding Asian Australians and particularly the mental health. So this might include, what you typically associate with the term issues, which psychosocial problems and adverse experiences and things like that. But they might also include structural problems, cultural problems that affect how we actually engage with our mental health. And so before we go into this, again, it'll be impossible to really cover the full depth of everything, and to cover all cultures, all languages. And so just bear that in mind when we kind of talk about some of these experiences. Why don't we start here with Chi, because you are a clinical psychiatrist, but among several other things, you've got a lot of research experience around Asian cultures and how they identify symptoms of mental health and how they might engage with or respond to mental health treatments. So what are some of these things that you've noticed in your research?
I think that we have a now much better understanding about how culture may affect people. And again, I'm not talking about any specific culture, but these are just kind of general observations in that we know that culture can affect the way people identify and what they recognize as mental symptoms. For example, typically in Asian cultures, physical expression of psychological distress is more common. So often people in Asian cultures might present more with physical symptoms to their GPs or their doctors, such as loss of energy, or some pain symptoms that might actually represent an underlying psychological problem. And how people identify these symptoms is reflected when we do worldwide surveys on mental disorders, such as depression. There's actually such a wide variation across the world. For instance, there's a threefold difference in the prevalence of depression when we look at different regions, comparing to North Africa or Middle Eastern region. And they seem to be much higher than some of the Asia Pacific countries and region. So what explains this wide variation? I think that cultural does play an important part in how people recognize it. The other aspect is that culture also influences how people view mental disorder, mental illness. I think Charles earlier mentioned about the example in Hong Kong. So in one of my early studies, it's been quite clear that the stigma towards mental illness remains quite prevalent among many Asian cultures. What I mean by stigma is the kind of fear towards people who suffer from mental illness, and which leads to then prejudice or even discrimination. And a number of studies have really found that compared to other cultures, that, for example, in a Canadian study, they look at Asians in Canada, and this group was found to have greater stigma towards mental illness than, say, the European or the Caucasian group. In Singapore, they've done quite a number of different studies looking at this issue of stigma. And for some various factors, like Singaporean Chinese tends to have less social tolerance and more negative attitudes towards people with mental illness compared to other ethnic groups. How they measure this is to look at what they call a social distance scores, like how closely would you associate yourself with someone with mental illness. And so when we look at what are some of these reasons why stigma might be more prevalent, I think that it has to do with a number of things. One is really how people in different cultures attach meanings to having a mental illness. Like in Chinese culture, I can speak because I'm Chinese background, there's a very strong sense of loss of faith, for instance. If you suffer from a mental illness, somehow your reputation is tarnished, or your family name is being tarnished. It can also mean a sign of weakness, and for some people, it could also mean a loss of even finding a suitable partner. So this can be quite prevalent in some cultures. Now, in other cultures, for example, there were studies looking at Muslims in Malaysia and also in Indonesia, and in this group, they seem to attribute that the cause of psychiatric illness, they seem to attribute them to other reasons like supernatural causes or spiritual possession or even something to do with religion. But what we can say is that it's very common in many Asian cultures that mental health or mental illness is a taboo topic. People don't talk about it. It's kept hidden. And that, I think, as Monica was saying, really discourages people from seeking help because they don't want to be associated with having a mental illness or be known as having a mental condition. And that's where people often have these view that, if you go to a mental hospital, that's the asylum, that's the Castle Peak in Hong Kong you were talking about, or the Woodbridge in Singapore that people in Singapore might know of. And I think that really is a huge barrier for people coming up and talking and seeking help for a mental condition. In fact, a study in North India found that the majority of people who suffer from mental illness, they actually gone in the first instance to seek treatment from a traditional healer or some sort of religious treatment before they actually sought treatment from a mental health professional. And I remember about a decade ago, there was a huge study in China, a very large epidemiological study in China. And they found that about 17% of the entire Chinese population, now we can convert then 1.4 billion, what does that mean? Had a diagnosable mental disorder. But when they asked them who actually sought help, only 8% ever sought help from a mental health from a professionals, and only about 5% ever seen a mental health professional. So you might ask yourself, well, what's happened to the other 90+%? So I think that understanding some of these social cultural meanings of having a mental illness, how people think and respond to this mental illness, is maybe the key to us trying to address this issue. How can we change the perception? How can we increase the understanding of people suffering from mental illness, and how we can encourage people to seek help earlier?
Yeah, and as you said, there's pretty like clear evidence basically that within kind of Asian cultures there might be more stigma, less inclination to seek mental health services, and I can definitely see that translating to, I guess, perhaps immigrant families that might move to Western countries, because that link might be transmitted basically through the family, maybe through the parents who have most of their cultural background in an Asian country. And I understand that the evidence for this probably is a bit more limited, but for kind of evidence of those of Asian background in a Western country, is that pretty similar, the kind of the research?
Yes, indeed. So many of the studies have actually been conducted in Western countries where they have ethnic populations in these Western countries, and it would appear that certainly it has to do with obviously how acculturated the population have been. I think certainly like the first generation would tend to have much more similar attitudes to mental health and mental illness compared to where they came from. Actually, it's interesting that education, you would have thought that education would be a modifying factor to change people's perspective, but it's not always the case, because I think that when you have a lot of value placed on the merits of being educated and having a good job, sometimes that can actually work against a better acceptance of having mental disorder, mental health problems. An example would be like if you are in certain society where there's this term called meritocracy, right? Where having high education, good paying jobs, having a good career is highly valued. Now, in these societies, it appears that in fact, the attitudes towards mental illness and mental disorder actually is worse, because it's harder for people with mental health problems to conform to the expectations of the society, right? When for example, it's common that we hear, in some Asian cultures where people will be sending their kids, in kindergarten for tuition because they want their children to be excelling and to be having high academic scores. Now, if you were struggling adolescents with mental health issues and you can't cope, now that's not going to go well in a society that values these values. So I think that often it can work against the acceptance of mental health, and so we need to be sensitive about those issues as well.
Yeah, I guess in a crude sense, it's like if I must be a high achieving person, and my view of mental health isn't that it can be compatible with being high achieving, then it might actually lead to even worse kind of outcomes or feelings or more stigma around it.
That's correct. Yes, and maybe even a lack of acceptance of one's mental vulnerabilities or mental health problems. I think earlier one of the panelists mentioned about the impact of COVID and looking after our mental health. So recognizing that we are all may be prone to develop mental health problems or mental health stress, but yet if you only value being high achieving and being successful, then you might be less able to accept that, oh, we all have mental health vulnerabilities.
Yeah, okay. And I think that's something that I think the other panelists might touch on in a little while. So why don't we move on to Asami? So you've talked about Shapes and Sounds. This is an online platform that really kind of hones in on mental health experiences of Asian Australians. So, you said that it was at least kind of partially inspired by some of your experiences in the mental health sector in Australia. Could you maybe talk a little bit more about that?
Yeah, of course. I think what I've really come to notice, so even as I studied in my master's degree, I'd always been interested in therapy, in some kind of therapeutic profession, and it ended up being music therapy, which I love. However, I never really understood until very recently that therapy, or what umbrellas this idea of therapy, is psychology. That psychology originated in Western Europe, and throughout its history, it has really not looked elsewhere to other parts of the world to understand how people who aren't Eurocentric experience health and experience mental health and experience things like relationships or community or families or family roles as well. And so we're kind of working within this system, this mental health system, and we're trying to access and seek therapeutic support from a mental health system that has long neglected to look elsewhere apart from that Eurocentric view of health and mental health, I should say. So I think that's a really important consideration to factor when we talk about Asian Australian mental health. It's not that the mental health system is broken, it's fantastic and it helps so many people. However, it's only very recently that a culturally responsive framework has been introduced, and that people have thought about, oh, isn't that interesting that Asian people experience family in a different way, or family relationships and family roles look quite different in Asian cultures. And when we forget to identify that therapy is a Eurocentric thing, what becomes really interesting is that sometimes experiences like internalized racism, for example, the symptoms of internalized racism, like this kind of self-hatred or hatred towards people who look like you or similar to you, can often be understood as things like low self-esteem or low self-worth, when in actual fact, we need to zoom out and we need to see the cultural context in which we live in, and how does being Asian and having an Asian face in a Western world affect our sense of selves and affect our sense of identity and belonging, that then feeds into something like internalized racism, but then maybe misunderstood by a therapist who doesn't have a culturally responsive practice. It's a little bit convoluted, but I hope that makes sense.
I think what you're saying is like really diving into what causes, like the very root cause, basically. So what causes the symptoms?
Exactly. We all live in context with the world that we live in. We're not just kind of individualized nervous systems, but actually we're in relationship with the world that we live in, and therefore our environment and our context definitely impacts our sense of selves and our health.
Yeah. Okay, we might move on to Charles here. So Charles is, I guess our kind of resident clinical psychiatrist here today. You've heard Chen, you've heard Asami talk about some specific issues. In your kind of practice with patients, a lot of whom are of an Asian background, you know, how much do some of the things you observe kind of align with what's been spoken about already?
Yeah, I think Chi and Asami have touched on many really important points. I really identify with what Chi has said about, you know, for example, in people who present to me in depression with mood disorders, a lot of the I guess the Westerners, you know, Caucasian, they may present with more, I guess, psychological issues like feeling sad or feeling down. They use the word depressed, but a lot of particularly the older age patients who are from the Asian background, they may talk more about their physical symptoms. They talk about there's change with their appetite, or they get headaches, or they can't sleep. So there's definitely, you know, that different presentations, and I think that, you know, having that cultural sensitivity is really important. You know, you don't miss the diagnosis. You know, when a patient coming to you with having stomach problems, you know, in fact, you know, you need to be mindful. You need to ask about their mental health. So I think this kind of particular, you know, this cross-cultural diagnosis is relevant in mental health. I mean, it's not so much of a problem in the other biological-driven pathologies such as cancer or rheumatic fever. But, you know, mental health and psychiatry is a concept that is quite, entrenched with the biology, the psychosocial, the cultural elements of a patient. So, and I mean, it would be working the other way around, you know, as Chi said, you know, a lot of Asian countries, you talk about black magic, you know. If you are not culturally aware of that fact, I mean, you may label someone and say they have hallucinations or they have persecutory ideas, and you label someone with psychosis or schizophrenia. And that just, you know, put the patient into the completely, you know, incorrect diagnosis. And that becomes a problem, you know, because I think the reliability of a psychiatric diagnosis is important in a doctor-patient relationship. And that has a lead-on effects to treatment, you know, lead-on effects to also research in the etiology and your epidemiology research. So, you know, once again, it points out how important cultural, you know, that cultural understanding has. Very, very interesting to hear Asami's concept of internalized, you know, stigma or racism, and I think you hear this in you know, some of the younger like Asian Australian population. Like, you know, it could be something subtle, you know, they kind of suppress their Asianness in the Caucasian population. You know, Asian, you know, culture is somewhat uncool. You know, you don't want to take out your lunchbox with, you know, Chinese vegetables or so, and you're kind of wanting to somehow show that you're very Australian. And as Asami said, you know, that leads to, you know, low self-esteem and, you know, of course, various other problems. You know, it does lead on to, you know, more vulnerable to, you know, develop anxiety problems or, you know, depression problems. And I think also, you know, if you are a young Asian or Australian who have a a first generation migrant parents who hold a very strong, a different cultural view on mental illness, you may get a clash with how you wanting to, get your mental health condition treated. I mean, as Chi mentioned that, a lot of the parents may be very reluctant for their children to seek help. It's about losing a face. They don't want other families to know. And also they may have this view that, mental health treatment, medications are addictive, you're going to be, it's going to damage your liver, you're not going to get off medication. So, and that poses a lot of conflicts in young Asian Australians. Do they seek help? Should I listen to my parents, or should I just keep it to myself? So, that's play a part in, how we're going to help our young Asian Australian population. So I guess these are some of the challenges, I guess issues that I see in my clinical practice.
I think it's interesting because there's it's kind of, mental health is almost more, it's more sensitive to someone who I guess is culturally, with similar cultural experiences as you, and I guess they can work in both a good and a bad way. In a bad way in terms of stigma, and a good way in terms of, maybe a health professional might be able to understand, diagnose better. So I guess, framing it that way almost makes it sound like a much higher risk, or like there's kind of more room for error. And then, it's kind of harder to get right than maybe an objective health problem, like a more physical health problem. So I guess this kind of might segue nicely into Monica. So Monica, when we were kind of talking about this beforehand, you talked a lot about kind of your own experiences, particularly in terms of, family expectations, success definitions, and stigma as well. Can you share, how that kind of affected you personally?
Yeah, absolutely. And Asami, Charles and Chi, all of what you said it very much resonates with me and what we've heard in our own communities. So I think to reflect back on my own sort of lived experience, I was the young Indian girl who was trying to be the good daughter and study hard and get a good job out of university. And I thought I was traveling along quite well. I'd, got the marks, my parents were happy. Off you go. Like, you think you've made it. And I went off to my sort of first graduate job out of university, and to my knowledge, hadn't had any history of mental health issues or anything. As I said, from my sort of own knowledge and diagnosis. So, but sort of in a year or two into sort of living independently away from family, I was experiencing symptoms of anxiety and depression, and I sort of had almost like a self-stigma, so to speak, and I sort of said, oh, look, it's nothing, I'll just shrug it off. I've gotten this far, I'm successful, I'm a professional, I'll be fine, just need to sort of keep my head up and keep moving forward. And I sort of went through a period of denial, whilst even actually having a diagnosis of depression and anxiety, that I actually had a problem. My parents didn't have sort of quite an understanding or education of what it really meant. It wasn't something that sort of, I guess, their generation talked a lot about. And they sort of, in conversations with them, it was around, they were saying, oh, look, it'll be fine. Maybe just take some time off, you'll be fine. not what one would say when someone has a flu or a actual physical disease. It's a very, very different reaction. So it actually took me a lot longer to seek help, because I actually had to sort of come to terms with all these things and realize I had been denying something that was happening to me, an illness that I really needed to go and seek help from a professional to get better from. And I'm so very glad I came to that realization. But it's certainly, all those factors around the shame, the fear of what my community or my friends and, family networks would think, all of those things sort of came into play to sort of stop me for a while in actually seeking help.
How long, was it actually, would you say, from when you maybe started experiencing symptoms, or kind of saying to yourself, you just got to keep your head up, to actually when you did kind of start feeling openly, at least to yourself, comfortable with it, acknowledging it, and seeing perhaps a health professional?
For me, I think it was about around about 6 months. So it was quite a long time. I was trying to just sort of shrug it off and get on with my life, so to speak. And obviously that, that meant there was a lot of physical, emotional, sort of difficult times during that period. I wasn't really helping myself by trying to pretend that I had all the coping mechanisms that I didn't.
Yeah. And I don't know if this kind of applies to you, but there's a common kind of thread of Asian, people with Asian background who have ended up in a Western society. There's often this kind of intergenerational gap, firstly in culture, but also in terms of comparison between parent and child. In the sense that, the child being in a Western country, maybe having gone to university, maybe having gone, to a graduate job that, pays decently and is relatively stable, that might actually increase the stigma of actually, mental health and kind of self-care, because it almost seems ridiculous given, what your parents might have gone through. Is that something you experienced?
So I think it's a tough one, because I think it's as a child of a migrant, it's very hard to understand, I guess, the migrant experience, and your own experience is very different from that of your parents, and the sacrifices they made, and the I guess the isolation from family that they had, and I wouldn't necessarily say it's a comparison, but yeah, I mean, you obviously then have your family who have experienced all these quite difficult things over their lifetime, to then go, well, I put you in a good school and you all you need to do is get a good job. Why is it so hard for you? In comparison, why are you not coping, essentially, to put it sort of in an overly simplistic way. But I think it's just sort of, I think we just have to appreciate that everyone's experience is very different, and your feelings are legitimate, and they are valid. And I, as I said, have a great relationship with my parents, and I love my parents dearly. But I will never be able to understand, I guess, their migrant experience and those things. And they have to, I guess, respect my experience and growing up in Australia, and I guess that the challenges I've had also.
I think that's really very insightful, and I think it's important for us to not overgeneralize that some factors that we commonly see in Asian cultures that might apply to every Asian or every person of that ethnic background. I think we have to assume that the reasons that might predispose someone to having mental health problems are usually much more complex than just the cultural aspects, and that we have to also respect that, you know, everyone's situation is different and everyone's context is different. So even if they come from a certain culture or certain ethnicity, it's very important for us not to just automatically label it, you know, or stereotype that, all right, they must be having issues with their parents, they must be having intergeneration problems, or they must have a very bad migration experience, because we then fall into the trap of stereotyping. So that, yes, indeed, we do need to be sensitive that these factors are important, cultural factors are important, but they may be these factors might be modified by other factors as well. And that individual factors might play a role, specific upbringing issues might play a role as well. So it's important not to be oversimplistic about when we talk about mental health and culture as well. That yes, we can see general patterns, but that doesn't mean that it applies to every person that we see. And I think we need to really try and pay closer attention to the individual within that cultural context. As I think Asami earlier said, you know, having an understanding of where this person sits in their community, in their cultural understanding, in their bubble, if you like. And then I think then you get a better sense of the person.
Yeah, and I think therein kind of lies even the difficulty of doing this talk, which is a nice, I think, segue into our last section. And just in the interest of time, we'll try to wrap up at 8:50, just so we can get the audience questions in. But it does kind of go nicely, I think, into this section, which is actually how to engage with mental health from a personal angle. And you know, if you're feeling maybe even overwhelmed with, you know, all the information that you just heard in the past half hour, hopefully this provides some relief and some clarity. And I thought we would start with Charles here. So, yeah, at the baseline level, if someone's kind of concerned about their own mental health, what are their actual options in terms of kind of engaging the health system? Like, what should they do first?
Yeah. Look, I think in Australia, primary mental health clinicians, you know, our GP is actually a very good start. You know, I've got a lot of GP colleagues. They mentioned that, you know, some 25 or 30% of the everyday issues they're dealing with is mental health related. So GP is actually very experienced in managing common high prevalent mental health conditions. I mean, of course, some you know, again, I'm not going to generalize. Some GPs are better than, you know, they're more interested in terms of their mental health knowledge than others. So I think you need to get a feel of, you know, whether this particular GP, they are mental health experienced. And I think that's often is a way, good, you know, it's a good start. I think that will help you to just navigate to get an assessment and to try to get a sense of the severity of the mental health condition. So I guess in the more mild to, you know, moderate cases, the GP may provide the psychoeducation. You know, it can, you know, in some cases, maybe, you know, referring to a psychologist through the mental health care plan would be a good start. So in Australia, we have what we call the Medicare sponsored mental health care plan. So what that means is you are going to be sponsored by the Medicare 10 sessions in a calendar year. You are getting a discounted rate to see a psychologist. You may still need to pay a gap, but it is a discounted fees. So of course, in more persistent and more severe cases, medication may be necessary. And again, often GP, they may have the experience to talk to you about the options, and they may be comfortable to even start you on medications. And of course, in the more, I guess, difficult cases or more, or more severe cases, referring to us as psychiatrists may be necessary to work out what may be the reason why the mental health condition is resistant to treatment, or if there's any, often we may have what we call comorbidities, where you may have a cluster of mental health disorder, the mood disorders, or personality disorder, or addiction problems, or ADHD, kind of blending to each other. It may be needing a psychiatric assessment to try to tease out, which elements are causing the problems, and what's the most appropriate treatment. So of course we are talking about the kind of the more moderate to severe end of the spectrum. So and I think, as other panelists has mentioned, we may have stigma associated with mental health. So in Australia, we also have other what we call the online mental health services. So they are designed to provide the psychoeducation, and they use a cognitive behavior therapy model. And in a way, it's not often it's not about replacing the clinicians, but to kind of introduce some of the elements that is useful in treatment, and often is augmenting to some of the clinicians' support. And I think it's often sometimes provided a good start. So in Australia, we have a number of really good online mental health resources. For example, in Sydney, we have one running by the St. Vincent's Hospital, is called the CrewFed. And also there's one organized by the Macquarie Hospital. It's called the Mind Spot. So it covers a lot of common mental health conditions, such as mood disorder, anxiety disorder, pain syndrome, addiction problems, and so forth. So I think that is a good way. As a start. I've actually done some research at Sydney Uni in designing and rolling out an online CBT model for adults who had insomnia problem, and the results are really good. Of course, again, I want to emphasize it's not to replace the clinicians, but I think that will help in people who for whatever reason, maybe stigma or geographical distance, to seek mental health. And I know we touch a bit about on trying to find a cultural a clinicians who share similar cultural or language background. So in terms of psychiatrists and psychologists, both our college, they have on their website a search function that you can screen for the language or the cultural background or ethnicity background that you wanted to find a clinician for support. So I think the support is out there.
And some of these references that Charles is talking about, by the way, they will come up in a second, so you will be able to see them. But just just conscious of time, in a nutshell, do you have to necessarily have a diagnosable mental illness, whether that's mild, moderate, severe, to just go and see a GP or see a psychologist potentially?
Mm-hmm. Well, I think that's a good point. It's I guess it's whenever you're in doubt, I think it's good to seek help. You are not. I mean, you can do you can do your Google search, but it's always best not to be a Google doctor and really trust a health professional's opinion and assessment. And I think also the other elements, the cultural, sometimes it's not about the diagnosis. It's about we need to use a bottom-up approach. You talk about your difficulties, your symptoms, and let your clinicians to try to provide the appropriate assessment and treatment.
Yeah, okay. Why don't we move to Monica now? So with Hardy in the room, you've kind of used a variety of social media and local and community-driven initiatives. What in your experience has actually kind of worked in engaging and really driving impact? And why do you think that is as well?
Yeah, absolutely. So we've tried a few different things. One of the most recent things we've done is actually using a technique called photo voice. So having sort of people in the community take photos or select photos that sort of reflect their own story around mental health, be it sort of their own experiences with their family or friends, or even just their views of mental health in our community. So that was a really interesting way in which sort of we gave, I guess, the community a tool to share their experience and reflections. So I think we've found that to be incredibly powerful. Because, as I said, whether it is something like an acute mental health issue or just things that, I guess, as I said, perspectives or things that are troubling people in the community, giving them different ways to explore that and share through storytelling, I think is a really important thing to do now, probably in pandemic environment more than ever. So yeah, we've found that, as I said, sort of most recently to be really, really helpful. We've also done events that are just purely sort of educational, sort of information sessions, so to speak. So where we've had clinicians and psychologists and psychiatrists come and really just sort of the basics and educate people about the signs and symptoms and when it's, what you're looking out for, whether it be for yourself in your own mental health or for those sort of your loved ones and your family around you. So I think we found, I'm particularly passionate about storytelling in sort of having shared my own lived experience over many years. But I think stories go a long way in starting to normalize these conversations, and sort of the more normalized these conversations are, as I said, that stigma and that shame starts to break down a little bit.
And I imagine maybe having it in the kind of community in the group setting might be helpful as well. Okay. Asami, so we kind of talked about this kind of concept of engaging your own mental health beforehand, and you had this really interesting idea of kind of self-care and modeling positive behaviors around mental health, kind of from within first. Could you talk a bit more about what that means exactly?
Of course. I think this relates to the second half of this question about how do we care for the mental health of the people around us? And that's such a common question, and especially in this day and age, most of us are probably concerned about someone or worried about a colleague or a friend or a family member. And I think we're always trying to think about what is the right thing to say. How do I encourage people to take care of their mental health? How do I almost convince them that they need support? And I think that it is very, very important to recognize that everyone is on their own journey, and no one creates change until they want to create change within themselves. And rather than worrying about what can I say, what can I do to encourage this person to take action in supporting their own health, sometimes it can be more powerful to model what taking care of yourself looks like. So we're all social creatures, which means that we're watching and we're learning from others and the people around us in our lives. And if you're the kind of person that's always stressed and always busy, but you're telling someone else, like, you shouldn't be so stressed, you should take time off work, then that person, it's a bit of a disconnect,
Dissonant?
I guess. Yes, that's it.
Yeah.
And I think it's important to take stock and think about, what are my actions saying? So perhaps you can model yourself taking time off work. Perhaps you can model yourself going to therapy, talking about your experiences, which helps, as Monica said, to normalize that experience. And as people start to watch and observe, they start to notice that, oh, Asami looks happier, she looks more well. And then they'll start to seek the pathway for their own change, I guess. It's really important that we need to respect people's journeys. You can send them lots of resources, but it's very important not to push people in the right direction.
Okay. And just to kind of wrap this all off with Chi, so you've talked about your research, and you've also kind of mentioned to me that destigmatization or kind of education might be really effective initiatives to help engage people with mental health. Could you speak a bit more about that?
Yes, I think that destigmatization is really the key to increasing better understanding of mental health problems. But what we don't know is really what's the best way to do that. What modifications do we have to make to roll out mental health education to different cultural groups, and having an understanding of what their cultural background, their beliefs, and the meaning of having mental health issues will be able to help us shape that. But we need more understanding. We also need better understanding about how do we engage people of different cultures to be to seek help, to be comfortable in talking to health professionals about their mental health problems. So we need to, I think, fine-tune and modify our approach, because it's not, one size doesn't fit all. And similarly, I think for those of us who are providing mental health care to others, it's also important for us to think about what are the cultural expectations of having mental health care or mental health treatment. What do people expect when they go and seek help? Will they accept this form of treatment? Because unless we have a better understanding of their cultural background, we cannot just be pushing a particular type of treatment or take drugs or a specific treatment. We have to understand, well, would this be acceptable to them? And I think that will increase the uptake and also the success of someone getting the best care for their mental health.
Wonderful. I think that concludes it in terms of set questions. Just in the interest of time, I think we will move straight to some really interesting audience questions that have kind of come in pre-submitted. So firstly, if you have any questions, please do submit them in the form that's, I think, been circulating in the chat. I'm going to read out some questions that have been pre-submitted, and any of the panelists are free to take any of these. And we might just do these a little bit quick fire, a minute or so, just so we can try and get through all of them. Firstly, here's the contact details. So I'm going to read out the question and give everyone a chance to jot these down if they have any questions specifically for the panelists. But I'm going to read firstly Arthur's question. So Arthur asks, given that religious belief seems to play a much more important role in Asian/migrant people, I would like to know about the role of religious belief i.e. belief in a higher power, and how it affects mental health. Is that similar to the impact of Asian culture, or are there subtle differences? I guess this is maybe a complex question that might be hard to answer in a minute.
I think there's no simple way of answering that. I think that religious beliefs can have an impact on mental health and on how one approach mental health. It's not equivalent. I think religion, I mean, there's a lot of overlap, but it's certainly not equivalent. I think that, again, we have to look at the specifics about what are the key cultural factors that impinge on mental health. And very often there are religious undertones and, that might influence that. But it is really important that we again look at more holistic picture of not just culture alone, but also looking at their family background, their individual aspects, their upbringing. Religion might be part of that as well, and who are their kind of supports in their lives. And I think that would give us a more comprehensive understanding of that individual.
All right, we'll move on to the next question. Hopefully everyone's kind of got a chance to jot that down, because I'm going to move on to what I think is quite a helpful slide. So before this event, we basically asked the panelists if they had any kind of resources that they would recommend. So here they are listed. Please feel free to jot these down and have a look yourself. And as I said, if you kind of have any specific questions about these resources, feel free to ask. But I'm going to move on to Vivian's question. So Vivian asked, how do you navigate conversations about mental health with family members who refuse to acknowledge its importance and believe it is weak to seek counselling?
I feel like Monica should answer that.
That's open to everyone.
Again, there's no easy way to answer that. I think sort of the best answer I have for that is through education, sort of pointing those people to, I guess, resources, research, data that puts it sort of factually in front of them. Reminding them and educating them that it is these sorts of illnesses are very common, that many people do seek help, and that I guess that's my best that's my best answer. So I guess reflecting on my own experience, just being able to point to fact and being able to point to best guidance, I guess, and advice and resources was incredibly helpful in sort of having what is a very difficult conversation.
Yeah. Okay, I'm going to move on to Jess's question. So Jess has asked, I'm an Asian who has always struggled with shame. Can you please tell me if there's a database of Asian psychologists who deal with this, please? So I get the feeling Asami might want to answer that one, but also, the second last resource, and even I guess the last resource might be a useful start. Go ahead.
So with Shapes and Sounds, one of the projects that I have been working on right from the start was to create a list of registered and clinical psychologists who are of Asian Australian background. And it's not always important to seek psychological support or find a therapist of the same or similar cultural background as you. It's not necessary. In therapy, your greatest outcomes come from the strength of your relationship with your therapist. So that could be of someone of any cultural background. However, I think that, as Charles mentioned earlier, there are sometimes some things that intuitively or without talking about specifically we understand. And seeking a psychologist of a similar cultural background as you can remove some of those barriers to engagement. Sometimes people feel really exhausted thinking about going to see a psychologist, not only having to explain the issues that they're going through, but also then having to explain the context. Oh, this is what my family is like, and this is what Asian families are like, and this is what blah, blah, blah. And that can be really exhausting when you're feeling unwell. So sometimes having an Asian Australian psychologist to support you in your therapeutic journey can be really helpful. And you can find that resource at justshapesandsounds.com. And similarly, have a look through a lot of the writing, because internalized racism is something that I'm very passionate about and I write a lot about as well.
So we have 2 more questions, so hopefully we can get through them really quickly. This last one is, second last one is anonymously asked. Have you ever encountered skepticism or dismissal from both Asians and non-Asians over Asian Australian issues because we're seen as privileged or a model minority? And how do you deal with that? And maybe not so easy to answer in a minute. So.
I feel, I'm just going to quickly jump in. I'm very passionate about these topics. I think that something that has helped me a lot, which might help you, whoever asked this question, is to become really critically reflective about the society in which we live, all of these norms that we so-called live with. And if you start to learn about history, and if you start to understand about what Asians have represented in this so-called system of what you mentioned, the model minority, why that exists. It exists because white people wanted to use Asians as a tool to oppress Black people in America. And somehow that's kind of transpired all across the West. So I think getting really critically reflective, looking into history, you can start with American history, Asian American history, because that's quite well documented. And this can start to open your mind up about the way in which Asian issues are often dismissed in the West, because that's definitely a thing. So what you're feeling is a real thing.
And probably a much more complex topic than what we have time for today,
Exactly.
which is also probably going to apply to the last question, but it is the last question, so I'll ask it anyway. Anonymously asked, how significant do you think the lack of representation or the often negative representations of Asians in Western media is for our mental health? And again, that's open to everyone.
Oh, this is highly significant. I think that there has been already quite a lot of research done, particularly at the start of the COVID pandemic, whereby certain communities or have been influenced by media reports that somewhat target Asians, particularly Asian of Chinese background, because that's where, when the pandemic first started. And it has been reported that people who experience discrimination, prejudice, and even sometimes outright abuse have suffered from mental health issues, and because it does create a lot of stress and mental health problems for people in this community if they are being targeted. So it's very important that we do advocate for responsible reporting and for media to have really good guidelines and adhere to to good practices in accurately reporting even public health issues like the pandemic.
And again, I think that's something that could probably be a talk in and of itself. I know that we've kind of discussed that in our team of doing a talk just about media. So look, that brings us to the end of the talk because it is 9 p.m. Thank you so much to everyone who's attended and really kind of helped to bring this together. So firstly, big thanks to our 4 panelists. If we give them, I guess, an E round of applause. You're also free, as I said, to message them privately if you have any thoughts or any gratitude to share to them. Secondly, big thanks to, I guess, my team as well for really doing the bulk of the work and helping to really make the event possible. As I said, it's just a very shallow dive into a topic that's much more complex. And so we really hope that you're able to actually get into that complexity as well. But hopefully you got something just from the talk. So thank you for attending. Please do connect with us on our socials. There's an optional feedback form if you want to let us know any of your thoughts, and our email's also there. And we hope you enjoyed yourselves. And most importantly, we hope you learned something.